There's a possibility that Medicare's eligibility age could go down to as low as 60. And here to talk with me about the many ripple effects is Jae Oh, author of Maximize Your Medicare. Jae, welcome.
Thank you for having me again, Bob.
Pleasure, Jae. So bring us up to speed on what's happening with Medicare eligibility and the potential for it to go down to 60.
Months ago, when President Biden was elected, and then the American Rescue Plan, the Democratic vision of healthcare in our country started to become more clear. Certainly, dental, vision, hearing would have been easy add-ons. In other words, easy to add to original Medicare. That was very, very predictable. However, what is new and different than months ago is that during the latest round of budgetary talks around the Biden budget, in fact, they have added and has passed through the House an agreement to also include the lowering of the Medicare eligibility age from 65 to 60. And that has tremendous implications to persons who even considering retirement.
So tell us about some of the ripple effects that either are intended or unintended.
The list is actually too long for us to actually completely cover here, Bob. But for the individual, what this means is that people's thought process about how much healthcare would cost or access to health insurance would cost is entirely different. Because due to the fact that Medicare, the Part B premium, for example, today, let's just use the $160 number, and it's going to rise. And also Part D average of $30 odd, and Medicare Advantage plans at $0 extra in addition to Part B. You can see that people have been under the presumptions that health insurance costs could be $900, $1,500 a month per person between 60 and 65. Now all of a sudden would drop dramatically.
So obviously there are some policy implications, but I guess for those who are pre-Medicare, who might be out of work and who might be using the marketplace for health insurance, as you mentioned, this could be a huge savings for folks who are out of the workforce and relying on ACA for their health insurance.
And in addition to those persons are quite clear, which is that the persons who are receiving the advanced premium tax credit, a topic that we've discussed multiple times, is the fact that there are persons who do not qualify for any advanced premium tax credit, higher income persons, yet who want to retire early, who are still looking at this number as a big cost to their monthly or annual budget. And by big, that is a $20,000 a year cost for premium on individual level. Now, all of a sudden, that be slashed, or even the possibility of it being slashed by 2/3 to 3/4 overnight. That means that people need to get, knowledgeable about Medicare and how it actually works. In addition to the 60 plus million that are current Medicare beneficiaries.
Right. So before I ask you to put odds on this making its way through the Senate and then into a bill that the president signs, the policy implications I think are interesting given the status of the trust funds for Medicare. This would add a burden to that or not?
I'm not part of the CBO, so as a result, it's a difficult hat to put on. I think that the ripple effects here, though, are enormous because, as I said, the list is too long to cover it completely. But even employers, right, they're going to, for example, a small business employer, they're all of a sudden going to be able to have persons who are between 60 and 65 as employees, and they will see their health insurance premium drop tremendously. In addition to that, even large employers, you will have persons who will find it more efficient on an overall basis, perhaps, to opt out of large employer health insurance. So as a result, the entire savings on the economy as a whole, very, very complicated soup indeed.
Yeah. So there seems on the face of it, lots to like about this. Should it go down to 60? Am I missing something?
Well, I think that the stakeholders involved in the healthcare system as a whole is complicated. And I think that there's certain parties, hospitals, doctors, who are going to have pushback. I think that that is not a complicated prediction to make. And simple reason is that the rate at which those providers are compensated from Medicare is notably lower than the individual health insurance market or the employer sponsored insurance market. In addition to that, the flexibility to negotiate those prices of healthcare delivery is severely limited under Medicare. When Medicare is calling the shots, it's difficult to negotiate with the federal government in that sense. But for health insurance, whether that be employer sponsored or in the individual market, notable more flexibility, something that healthcare providers are unlikely to want to give away that easily.
Yeah. So I guess one possible downstream adverse ripple effect would be that maybe more doctors choose not to accept Medicare if this goes through, given the price pressures.
Difficult to tell. We don't have a crystal ball on that one, but certainly as a whole, could you see hospitals, for example, hospital systems trying to resist a wholesale change of Medicare eligibility age? Very possible.
Yeah. All right, Jay, anything that we might have missed or anything that you need to reemphasize?
As I said, Bob, I'm sure we've not mentioned a long list of extra ripple effects, only the 5,000 foot view here. I'm sure more issues will arise shortly.
Yeah. Well, Jay, it's always a pleasure having you give us an update on what's going on in the world of Medicare. Appreciate it.